These videos have been developed for instructional purposes. For this reason, the nursing students and nursing instructor review the steps of the skills at the bedside. In actual nursing practice, you and your instructor should decide if this approach is appropriate for you.
So they're talking on the phone, and after a while, she has this realization that she has no idea who this person is. She thought it was her friend Steven, but then she thinks again, and it's not his voice after all.
Okay, wait. Some guy dials the wrong number. Your friend answers, and he goes, "Hey, it's me." And they just talk for an hour.
What's going on, guys?
Jeannie's going to a wedding. She's just telling me how the bride and groom met. He dialed her number by accident.
They both thought they were talking to somebody they knew.
Well, it's a cute story.
I know, right?
Good morning, everyone. How are you?
Hi.
Today, I'd like to focus on monitoring IV sites and infusion rates. Now, when do we check this?
At the beginning of the shift, as part of the initial assessment.
And periodic intervals throughout the day.
Right. Another nursing responsibility is to monitor the IV insertion sites for possible complications as well.
Now that you do every hour.
Exactly. And sometimes fluid administration involves multiple bags or bottles. So it's really important to stay on top of monitoring and replacing the fluid containers.
How low should the container go before we start to prepare the next one?
Usually about 50 cc's. You also want to check the date and time on the infusion administration set to see if that needs to be replaced as well, okay? All right, Tamika, let's go see your first patient.
Okay.
And we'll catch up with you two in a little bit, all right?
All right.
Thank you.
See you guys later.
Bye.
Well, my patient is receiving IV fluid since having surgery 4 days ago. He has an IV infusion of 1,000 cc's of normal saline, which is running at 80 cc's per hour. It's about time to assess the site and get the next container of ordered solution ready for administration.
Okay, so what's your plan, Tamika?
Well, using the MAR, I've already checked the order for the type of IV solution and the rate of infusion. Then I calculated the hourly rate of infusion and the drops per minute.
Okay. Are you using a gravity infusion system?
Yes, I have tubing that delivers 10 drops per cc. So the drip rate is 14 drops per minute.
Great. Now remember, when using an IV infusion via gravity, the time tape is essential for monitoring the infusion rate, okay?
Right. Okay.
Great. Well, gather your things and I'll meet you there.
Okay, thanks.
We'll take a look at the pumps in a little while.
Okay.
Okay, let's use the MAR to compare the solution container label with the order to check for accuracy.
Okay, the 5 right should help with this.
Sure will.
Okay, everything looks good. Now, I check for leaks, impurities, and the expiration date.
Great.
Okay.
Let's label the solution, Tamika.
Okay. The patient's name, the solution type, and any additives, and the date and time the bag's to be started.
And remember, if the container comes in with a pre-printed pharmacy label, confirm the information on the label with the record, all right?
Okay. And I place the time strip on the solution bag, right?
Right. You align it with the volume amount on the solution.
Okay.
Okay. Let's go see the patient.
Okay. Hi, Mr. Conway. How are you? Mr. Conway, this is Ms. Swenson, my instructor. She'll be observing as I check your IV infusion and change the fluid container. Is that okay?
Not a problem. Changing the oil, eh?
That's right. I'd like to see your ID band. I'll check it with the MAR. And what is your name?
Dan Conway.
Good.
And I'd like to be filled up with premium, not regular.
We'll take good care of you. And let's just check the rate of flow. Great. The drops per minute match our calculations. So, Mr. Conway, I'd like to check your IV site. Is that okay?
Go right ahead.
Okay.
You know, I always thought that being a mechanic made us like colleagues, you know?
How's that?
Well, you know, you're checking the fluid levels, making sure clamps are tight.
Right.
We're a lot alike.
You know, you might be right. Your dressing looks really good. It's intact, adhering to the skin at all edges, no leaks.
Thank goodness. I know a lot about leaks.
Are you feeling any pain?
Not at all.
Okay, great. Now, we just want to check the site for swelling, pain, coolness, and pallor.
Why is that?
Well, it could be a sign of fluid infiltration into the tissue around the IV catheter.
Which doesn't sound good.
It's not a good thing. We also look for redness, swelling, heat, or pain. That can indicate the development of phlebitis, which is an inflammation of the blood vessel at the site.
You see, we talk the same confusing way to our clients.
I'm sorry. I mean, everything looks good. Okay, so now I'm just going to change the solution. First, I close the clamp on the administration set tubing. Take the container that was hanging from the IV stand and invert it.
Good. Now remove the spike from the old bag. Be careful not to touch it.
Okay.
There you go.
Okay, I carefully remove the protective cover seal at the entry port.
Careful not to touch that too. Now just be very careful. Insert that with a firm push and kind of twisting motion. There
Okay.
you go. Careful not to touch again, of course.
Okay.
Good job.
Okay, now I hang the new IV solution bag on the IV pole. Oh, the drip chamber isn't half full.
Just squeeze until it's half filled, Tamika.
Okay.
There you go.
All right. Now I unclamp and adjust the infusion rate as ordered, which is 14 drops per minute or 80 cc's per hour. Okay, now, Mr. Conway, be sure to call me for any assistance if you feel any discomfort or you notice the bag getting empty, okay?
I'll be vigilant.
Okay, then I'll see you in a little bit.
Sounds good.
Okay.
All right, Tamika. You'll want to document your assessment on the
Okay.
flow sheet and your administration on the MAR, okay?
Okay.
Great job.
What's going on? You got a date?
Yeah, I've got time for that.
I'll catch up with you in a little bit.
Okay.
How are you doing, Robert?
I'm doing all right. I've got a patient that needs her administration tubing changed today and her current bag of IV solution in an hour, so I'm keeping track of time.
Very good. Why does the tubing need to be changed?
Well, doesn't that prevent development of complications from contamination?
That's right. Why don't we take a look at how to change the solution and the administration set at the same time?
Sounds good.
Okay. Looks like you have all the supplies you need. So what's the situation with your patient?
Well, she was admitted to the hospital with a generalized infection due to a urinary tract infection. She'd been receiving IV fluids to help with dehydration because she's been experiencing loss of appetite and fever.
Okay. So what are the orders?
Let me see here. Half normal saline solution to be infused at 125 cc's an hour.
Okay. Well, let's check the solution and label it.
Okay. Okay. Okay, now the solution bag is all set. Now for the tubing. I'll just take the new administration set from the package and clamp the tube.
Okay, and carefully remove the protective cover seal at the entry port of the new infusion container. And be very careful not to touch the port to keep it sterile.
Okay. And I remove the protective covering from the infusion spike,
Again,
making sure not to touch it or contaminate it.
right.
Now just hold the IV solution container steady, and I insert the spike. Oh, now use a firm push twisting motion into the entry port, right?
You've got it.
Okay.
Now just hang the IV solution bag on the IV pole and squeeze the drip chamber until it's half filled with solution.
Okay. There we go. Now I release the clamp on the tubing, allowing the fluid to move through the tubing.
And as the fluid moves through the tubing, as it reaches the Y ports, invert the tubing to fill the port. You should do this for each port on the tubing. There you go.
Now this is called priming the tubing.
That's right. It's done to remove air from the tubing. Now close the clamp and check to make sure no air bubbles remain.
All set.
Okay, great. Now we can take it to your patient. Just be sure to label the new tubing with date and time information, and we're good to go.
Okay. Hi, Mrs. Hanson.
Hi.
How's it going?
It's going all right.
Hello, how are you?
Hi.
Remember Mrs. Swenson?
Yeah. Hi.
How are you?
I'm just here to replace your IV container and tubing for your intravenous infusion. Is that all right?
Sure.
All right. Let me take a look at your ID band. Can you tell me your name?
I can. It's Catherine Henson.
Okay, thank you. How you feeling?
I'm feeling okay. For the most part. I miss my kids. This is the longest I've been away from them. Do you have any kids?
No.
And you?
No.
Oh, you've got to. I'm telling you, it's the best thing that'll ever happen to you. They're just so, well, of course, during the day they will rob your mind and your soul and your sanity. But truly, when they want to cuddle up to you at night, or you're tucking them in and you look at them and they're just, they're God's little miracles.
Oh, I hope you get to go home soon, Mrs. Hanson.
Me too. Get to it.
I'm just going to get started, okay?
Okay.
First, I'm going to raise your bed up. There we go. And I'm going to lower your railings. There we go. Now I'm just going to hang the IV bag and tubing on the IV pole. There we go. And then I'm going to clamp off the existing IV tubing.
Also close the clamp on the short extension tubing connected to the catheter in the patient's arm, Robert.
Okay. Okay, now I'm going to remove the current infusion tubing from the access cap, and I'm going to swab the access cap with an alcohol wipe. Go. And I will insert the new tubing into the access cap.
Let's secure the IV tubing with tape as needed, Robert.
Okay. There we go. And I open the closure clamp on the short extension tubing attached to the IV catheter. Then I open the clamp on the infusion set and adjust the rate.
Very good.
That's all we needed, Miss Hanson.
Well, thank you very much.
You're welcome. If you need anything else, just give us a ring, okay?
I can do that.
Now let's just get you back in action here. Go ahead, lower your bed.
Okay.
How's that?
Beautiful.
Just going to clean up for you, okay?
Okay.
Okay, I'm getting ready to go with Jeannie to do an IV dressing change, and I thought we should just check in really quick about this process because IV sites are a potential entry point for microorganisms into the bloodstream.
That's why we use sealed IV dressings, right?
That's right. We do that to prevent complications. When these dressings need to be changed, it's important to observe meticulous technique to minimize the possibility of contamination.
Now, how often are IV dressings changed?
Well, IV site dressing changes often coincide with IV site rotations, usually every 3 to 4 days. Keep in mind that dressing changes might be required more often based on your nursing assessment and judgment.
Like any IV dressing that is damp, loosened, or soiled should be changed immediately, right?
Exactly. So why don't you two see to your patients, and Jeannie and I will head over to her patient.
Okay.
Sounds good.
Ms. Swenson, I brought that up because my patient's IV dressing isn't due to be changed for another day. But when I was changing the IV solution container and the tubing, I noticed that the dressing had become loose.
Well, you're right, Jeannie. We should change that dressing. So let's go.
Okay. Mrs. Markowitz? Hello. Hi, Ms. Markowitz.
Hi.
We're here because your IV site dressing is loose. I'd like to change it for you now. Would that be okay?
Please do.
Okay, I just need to check your ID band. Can you tell me your full name, please?
Sharon Markowitz.
Okay. I'm going to turn off the pump and clamp the line. Okay. Could you put your arm up on the table for me?
Sure.
Now I'll place this towel underneath your arm. Great. Now we can get the dressing off.
Be sure to leave the tape that anchors the IV catheter in place, Jeannie.
Okay. You okay?
Mm-hmm.
Okay, now when you loosen the tape holding the catheter, be sure to use your other hand to hold the catheter in place, okay?
Okay.
Do you need an adhesive remover?
No, it's coming right off.
Okay.
Now cleanse the entry site using friction for 30 seconds. And let that dry.
All right. Now you can apply a new sterile tape strip to the IV catheter at the entry site. Then the transparent dressing.
Now for the label. Date, time, and initials. Now I'll apply the label. And I'll secure the tubing. Now I can open the clamp, turn on the pump.
Thank you.
Does everything feel okay?
Feels fine.
Okay, just ring if you need anything.
Okay.
Thank you, Ms. Markowitz. Nice work, Jeannie.
Thank you. You did good. Okay, I'm going to get this out of the way.
Ms. Swenson.
Hey, Robert.
Hi. My patient is eating and drinking enough on her own to meet her needs. So her doctor has decided to stop continuous infusion of IV fluids.
Okay, well, it looks like you have the supplies you need. Alcohol swabs, a syringe with normal saline for flushing, tape, and the MAR.
But my patient is receiving IV antibiotics to treat an infection. So we'll need an access to give her the medications.
Right. So we'll cap the IV line and leave the site as an access point for intermittent or emergency use.
So we'll leave the IV catheter connected to the short extension tubing and sealed with an access cap?
That's right.
Okay.
Let's go.
Hi, Mrs. Hanson, we're back. Hi. Are you doing such a good job drinking on your own? Your doctor has decided to stop your infusion. Remember, though, that we're giving you that medication through your IV for your infection, so I'm not going to take the whole IV out. I'll leave a short piece so it can give you your medication, all right?
Sounds good.
All right, may I check your ID band?
Yes, you may.
Okay. And please tell me your name.
Catherine Hansen.
Okay.
Still, I've always wanted something more pizzazzy, like Ruby Ray. What do you think?
Ruby Ray, that sounds pretty... That is dazzy.
Yeah.
Let me take a look at your IV site.
Okay, so this means that I'm getting better. Should I maybe call home and let them know that I may be on my way? Although I may have to clean up after my little angels. They tend to leave the place a wreck. I can stay here, right? I will be so quiet. I swear you'll never hear from me.
I'm sorry.
Always good to ask, though.
All right, everything looks fine. Now I'll just clamp off the primary IV tubing. And I'll also clamp off the short extension tubing. Go. And then remove the primary IV tubing from the access cap. Oh. All right. Now I'll take an alcohol swab to cleanse the excess cap. And I'll take a saline flush syringe. Make sure it's got no air bubbles. And I'll insert it in the access cap. Unclamp the short extension tubing. And now, flush the line.
Now remove the syringe carefully and reclamp the tubing. And you can use tape to secure the extension tubing if needed.
I think it's all secure. All set.
All right. Thank you.
Thank
Thank you. Buzz if you need anything.
The only thing I need, trade places?
I don't think so.
We'll see you later.
Okay, see you later.
See you later.
Well, I need to cap my patient's IV line, but when I was caring for her earlier, I noticed that the IV tubing is connected directly into her catheter hub.
Well, this would be a good opportunity to connect short extension tubing to the IV catheter to minimize future blood exposure.
Can you observe?
Of course. Looks like you've got your supplies, so let's go to the patient's room.
Thanks. Mrs. Spot,
Hi.
you're doing great. So good, in fact, that we're here to disconnect your intravenous infusion.
Oh, that's good news.
Isn't it? I just need to check your ID band. Can you tell me your full name, please?
Carla Spot.
Okay. Let's put your arm right up on the table.
Okay.
We're going to attach short extension tubing to the IV catheter. So let's prime the extension tubing with normal saline, Jeannie. You might want to clean that cap first. Okay. Now you can clamp the tubing. Okay, you can remove the alt dressing. Okay. Now you want to apply gentle pressure with your hand at the end of the catheter under the skin when removing the existing tubing. This will prevent blood from exiting the catheter hub when the tubing is removed.
Now I'll stabilize the IV catheter hub. With my other hand, I'll quickly twist and disconnect the IV tubing from the IV catheter. Now I'll take my primed extension tubing, remove the end cap, and attach it to the IV catheter hub.
Be careful to not contaminate the ends of the tubing, okay?
Okay, now I'll clean the end cap and flush it. Date, time, and initials. Now I'll tape the extension tubing to keep it in place and prevent dislodgement. Looking good.
Thank you.
Thank you, Ms. Spot. I'll leave you to clean up, Jeannie. Good work.
Thank you. Does everything feel okay?
Yeah, thank you very much.
Good. Okay, you have a good one.
Thank you very much.
So she hasn't picked the bridesmaid's dress yet?
No, she's torn between these. Look.
What does she have, a pumpkin theme going for a wedding?
It seems that way.
I like that one on top.
That is
Pretty. Okay, guys, I know we've all been running around a lot today, but just wanted to take a minute to talk about the things we looked at and see if anyone has any questions.
Ms. Winston, what would I do if a patient is complaining that the needle in her arm feels funny?
Well, the first thing you would want to do is check the integrity of the IV system, the IV solution, and tubing, and validate the correct drip rate.
What if the IV is flowing slower than the intended rate?
Well, if the setup is intact, it could indicate a problem at the site, such as infiltration or infection. So you should next assess the site for localized redness, edema, warmth, coolness, pallor, and soreness or pain at the site.
And if these symptoms are present?
Well, you would stop the infusion, discontinue the existing IV, and start a new IV access at a different site.
And notify the physician.
Exactly. You can also apply a warm compress to the original IV site, depending on the type of solution that was being administered and facility policy. Okay, now Jeannie and I had a situation today with her patient when his IV was not running. Right, Jeannie?
Yes, he had an order for a normal saline solution to infuse at 100 cc's an hour via a gravity system.
Tamika, what would you do in this situation?
Well, I would confirm the IV solution and rate of infusion with the physician's order.
Good.
Then I'd verify the solution contents of the IV that is infusing and check the tubing for kinks, pressure points, and blockages.
And what would she do next, Robert?
Make sure that all the connections in the system are tight.
That's right. And also check to see that all the clamps are open, and check the roller clamp to adjust the rate if needed. What did we do, Jeannie?
Well, we checked to make sure the patient wasn't sitting or lying on the tubing, and that his arm wasn't raised above the level of his heart.
And what was the problem we found?
The IV had been placed in the antecubital fossa, and his arm had been bent at the elbow for a long period of time. This can also happen if the IV is in the wrist and the wrist is bent.
Right. So we explained what was happening to the patient, then he understood that he needed to try to keep his arm straight most of the time.
What would we do if there were air bubbles in the IV tubing?
Well, if the bubbles are above the roller clamp, they can easily be removed by closing the clamp, stretching the tubing downward, and tapping the tubing with your finger so the bubbles rise to the drip chamber.
Okay.
And if there's a larger amount of air in the tubing, you swab the medication port on the tubing below the air with alcohol. Allow it to dry, then insert a syringe into the port below the air. Using the syringe, aspirate the air from the tubing.
Okay, I did not know that.
Well, great job today, guys. It looks like you've all got a good handle on this. So have a great night, and we'll meet back here tomorrow.
Okay.
Bye.
Well, enjoy your pumpkin dress.
Who'd pick that color?
The same person who talks for an hour on the phone with somebody they don't even know.
They're not that bad.